ARUSC, a system to optimize antibiotic use. De-escalation, do we really need to do that? An 85-year-old female nursing home resident was admitted for a possible healthcare-associated pneumonia and IV piperacillin tazobactam was ordered. ARUSC was auto-triggered. The resident chose empiric category for new infection. Looked through the diagnostic clues and confirmed that pneumonia was present as evident on the chest X-ray. An additional blood culture was ordered as only one set was ordered initially. On day 3, blood cultures were positive for E. coli. ARUSC was queried for definitive therapy. Definitive antibiotic category was chosen and the relevant culture selected. The patient still had fever in the last 24 hours and condition has remained stable. ARUSC suggested IV ceftriaxone with step-down oral ciprofloxacin. Duration accounted for the prior 3 days of empiric piperacillin tazobactam. Ciprofloxacin was chosen due to bacterium allergy. Why need to de-escalate? What does it mean? Why do we need to do that? Is it effective? De-escalation refers to narrowing antibiotic spectrum when cultures results are available. It can bring about less broad-spectrum antibiotic use, less multi-drug resistant organisms and better patient outcomes. In a TTSH study on patients on carbapenems, de-escalation brought about lower antibiotic duration, less adverse effect and less carbapenem resistance Acinetobacter and Clostridium difficile associated diarrhea. A recent meta-analysis concluded that de-escalation according to cultures or clinical reasons is safe in patients with severe sepsis and septic shock. Another meta-analysis concluded that de-escalation according to culture results reduced mortality by 40%. On day 3 of empiric antibiotics, query ARUSC for definitive culture-directed de-escalation. When cultures are negative, ARUSC provides recommendations for de-escalation based on patient's ID condition and current clinical status according to hospital guidelines. For culture-directed de-escalation, select definitive category, ID condition and relevant culture. Indicate patient's clinical status. Antibiotic recommendations and treatment clues are then provided. For de-escalation when cultures are negative, select definitive category, ID condition and indicated patient's clinical status. Antibiotic recommendations and treatment clues are then provided.
Thank you for watching. Please go to the Google form to answer some questions and stand to win attractive prizes. Antibiotics save it from extinction.
Created using Powtoon.